non-sterile glove situation in this skill, so make sure you have your supplies for that. Assessment is really important. The fact that you take the time to assess your site and everything. So outside the door, I've knocked and washed my hands as I come into my room. I've got my supplies with me. I'm going to go ahead and clean my table while I introduce myself to my patient. Hi, sir. My name's Jocelyn. I'm your nurse today, and I'm here to do your dressing change. Now, I gave you that pain medicine about a half an hour ago, or I asked you to use your hit your PCA pump a few times so that you won't be in any pain while we do this. And he's like, yeah, that's working great. What's your pain on a 0 to 10 scale? He says it's, 2, and that, the pain medicine really works for this. I may ask him some questions about how that dressing change went, confirm his name and date of birth as needed. And so we're going to go ahead and do this. He's in a good position. For me, I think I'll bring him up a little bit though. I've got my sterile field, this is my preference. I'm right-handed, and I kind of like my area set up this way so that I can kind of keep an eye on things, but yet also be close to my patient, not have to turn my back on anything if I don't need to. And there's two choices about setting up your sterile field. So you can start by putting on your clean gloves, taking off the dressing, putting your sterile field up, and then doing it. Or you can put your sterile field up first, take off the dressing, put in your stuff, and be done. I think what makes a difference is how elaborate your situation is. So in the patient you were talking about where you have miles and miles of gauze, I'm probably not going to put my sterile field up until after I take that dressing down, because I have another one of those. Because I don't want to leave it sitting here open and exposed for a long time while I'm undressing the dressing. If it's pretty straightforward dressing, I'll have everything set up, I'll pull it out, put the new one in, be done. So thank you. So I think it just depends on the situation. There's no right or wrong. I don't even know off the top of my head which way the checklist shows it. But I'll set up my field first, and then I will take down his dressing. So I've cleaned my site, washed my hands. I have an ABD pad. That's going to be the outermost layer. It's called the secondary dressing. The primary dressing on this one is going to be some fluffs. I'm only going to use one on the mannequin. It's going to be saline moistened, because that's my order, damp to dry, or wet to damp. Dressing change, so that'll be the first one on the inside. On top of that is a couple gauze just to absorb any extra drainage, and like I said, the ABD on the outside. Tape, which I'll have torn off now because it's really hard to do once my gloves are on. So a couple pieces of tape ready to go. And then to open these, you want to make sure that you remember your sterile field rules. I usually just treat the outer edge that's got the glue marking on it as the non-sterile so that I can touch it, but don't touch the inside, don't touch this part. Those are all sterile. Make sure that this is not flopping forward. Make sure you've got it open all the way away from you. If it wants to flop forward, some students will only open it halfway and then they're digging their hand in there. That's contaminating the field, right? So you want it open all the way away from you, and then you don't want to reach over at all. Oh, I'm going to go grab this thing or whatever. You don't want to do that. You want to leave it like that. And then the gauze, I would say this one's tricky because it likes to jump out of the package when you open it because it's so narrow. And then this one's just tricky because it likes to tear. So I usually start it and then just kind of stabilize it with my fingers and pull it away from me. Like that. And then this is my fluff. In the hospitals, these usually come in a package like this with the plastic on the bottom. But these don't have that, just for the sake of saving you some money in your kits. But they are water resistant, so you can pour a little saline on them and they'll be okay. So put this one away from me. Notice how I'm not letting my arm go over that other sterile one. Okay, that's set up. I'm going to go ahead and take my bottle. Make sure it's labeled for 24 hours expiration if it's the first time I've used it. Pour just takes the littlest bit, maybe about, there we go, just a couple inches circle of saline. The most common material or liquid they have us use is saline. It's not uncommon to use just a little flush. A couple of those saline flushes works too. So you can use that to moisten your dressing material. I'm going to use this to measure here in a minute. And then I'm going to set aside my gloves. They're going to need a spot where I'm going to be able to put them on. So those are good. I want you to use sterile field. Okay. All right. Now I'm going to go ahead and take his dressing off. So he says his pain is good. The medicine's working. I've got all my supplies where I need them. I'm going to take this rail down too. Makes it easier for me to reach him. All right, so we're going to check out his wound here. We found his dressing. Hopefully the previous shift has timed and dated it, so I know when it's going to expire, or when it was put in, that is. So we'll say this is a couple hours old, and the orders are every 4 hours. So I'm going to remove the first outer dressing. And something I forgot to do was have the trash can near me. There you go. Second layer here is the gauze, like I said. That goes in the trash also. And then third is taking out the packing. And, you know, in a normal patient, this is going to be saturated with some drainage, blood, whatever, breakdown tissue, whatever might be coming out of there.
Now, sometimes it can be dried
Slough.
out.
Yeah, if it's too dry, it will actually pull.
Can you just take some saline flushes in that situation?
With the dried out dressing, you don't want to soak it, right, because that would defeat the debridement, but you do want to moisten it a little. So you can squirt a little bit in there just so it comes out, because you don't want to be yanking off tissue and create bleeding, but you do want to be pulling out all the dead tissue that's hopefully attached to it. So removing the dressing, I now take a minute to take a look at his incision. I'm assessing the granulation tissue, which is nice and beefy red. I see a little bit of redness around the skin around the incision, around the wound, peri-wound area. Feel for warmth, right? Is it super hot, super cold? I can do this. I'm not going to stick my hand in there, so I can do this with clean gloves, right? Checking the temperature, checking for bogginess. What's that? Mushy. If it's mushy, what did that tell me if it's boggy?
Tunneling.
Yeah, tunneling or infection has spread, right? If it's really, really firm, there may be some pus or something under the skin, so I want to assess for that. And then an important step is measuring. So these are nice to have for the sake of your kits. Just practice and reuse it. Pretend like it's new each time. But I can do this without a sterile hand because this part's sterile. I'm not touching that. You know, put it in there, see how deep the wound is. Measure it against the ruler, so it's like 2 centimeters deep at its deepest, and it's about 2 centimeters, 3 centimeters wide. I can measure. Your kits also have that little plastic wound measuring tool. That's useful. You can use that also to show how you would measure with it. I would probably lay it over the wound and trace the shape of the wound if it was very irregular shaped. And then what's the most accurate way to sort of document the appearance of a wound?
Take a picture.
Take a picture, yeah. So if your facility has, usually they'll have a special camera that they use that's secure or whatever, or the wound care nurse will have one. They'll come around once a week or once a day and take a picture of it to track the healing of that wound. So if you can, make sure you take a chance. If that is an option, make sure you're prepared for that before you take the dressing off, especially if it's not a frequently changed dressing, because we don't want to miss that opportunity, right?
I noticed when they document the tunneling, they use like 12 o'clock, 6 o'clock, whatever. Are they acting like 12 o'clock was the patient's head?
I'm thinking, yeah, I would if I was, because I'm looking at it now and it's at 2 o'clock, 3 o'clock. Yeah. So there's lots of different, and that's a great point. You know, there's different ways. So look at the documentation, see how the wound care nurse tracks it and documents it. Make sure you understand the way they do it there. So I've inspected, I've assessed, so I'll be ready to put an assessment in. Now I'm going to go ahead and put my sterile gloves on and do the sterile part of the procedure. So again, wash my hands, sanitize, open my gloves up, remembering not to overlap any of the packaging. Like you did with Foley's, you don't want to overlap this onto there, so I want to make sure I have enough room to glove up. With these packages, you want to make sure that you kind of fold it so it doesn't flop back on you, because they like to do that. And there's not a lot of room on the table, so you have to kind of be creative. And I'm going to open it. Make sure that it's the same thing, that it doesn't flop back on me. This way, right? So pinch the first one. And hold my hand up away from my body so I won't touch anything. Get my thumb in the hole, that's important. Thumb in hole, done. Underneath. Now I'm going to scoop. And again, you can stabilize the paper with your hand and the non-sterile part of it. And I usually have to use both hands, all my fingers, to kind of pick it up. But once I've got it up off the paper, I get my thumb out of the way. Now I'm going to go ahead and put this on. Sterile gloves are on. Now I'm going to go ahead and place my fluff first. So squeeze that out, unfluff it. This needs to be, you know, you're not folding this and putting it in like this, because that decreases the ability to kind of hit all the nooks and crannies. You want it to be very three-dimensional so that it touches all the wound edges on the inside, right? So we don't want any empty spaces. So when I place it, I'm going to be very careful about that. You may see some people use tweezers or one of these little Q-tip things. That's fine. Some places you'll have like a set of sterile tweezers or tweezers that have been wiped down and disinfected. You'll often see this done just clean, not sterile, which is perfectly okay also. Just depends on what's going on with the patient. And the only difference between the clean and the sterile is that you're not wearing sterile gloves. You're treating everything else sterilely, just like this, right? You're using all the same principles. You're just wearing clean gloves instead.
For testing, we're using sterile.
Yes, for testing, you're using sterile. In practice, you may see lots of variations. I just try to warn you that because you'll be like, but I saw at the VA they stuck it in there with a rusty knife, and I don't understand. Didn't record that, did you? And like the roll you were talking about, you can cut the roll. You have all that ready for you now. But for our sake, we're doing it sterile. I've packed it. I'm making sure none of the packing is touching any of the healthy skin around the wound because that will increase wound breakdown, right? Tissue breakdown of the healthy skin. If you saw I only used one fluff on him, that was perfect. 2 gauzes are next to help cover that. 1 ABD pad across the top, and then we'll go ahead and tape it.
So, did you technically just break a sterile field by dropping your hands below your waist?
At this point, I'm not sterile.
Okay.
So once I've got the ABD on,
Once you're doing that, you're fine.
yeah.
Okay.
So once it's all covered, you're fine. You switch to clean anyhow. So I could reach over here and touch the tape exactly. But yeah, for sure, if I was still doing sterile, I wouldn't want my hands down there, which is again why I wouldn't necessarily drop things in the trash. A lot of places have those little mini biohazard bags too, so you can have one of those to drop your stuff in there if for whatever reason you're trying to stay sterile. But at this point now we are just clean once the ABD pad's on and everything's covered. I'm going to sign and date, time it, right? And then go ahead and cover him back up. If their wound needs any cleansing, you can do that at various stages in the procedure depending on what the deal is. Sometimes it's just lay him on his side and squirt it with a saline syringe. Other times it might be more elaborate and you may have to wear sterile gloves for the cleansing and then change out. But for our purposes, we're just doing this very simple version of the procedure. And now that I'm done with that dressing change, I will go ahead and document. So the documentation will include the fact that I did it, the materials I used, how many fluffs I put in there, or if it was length, how many inches of, approximately how many inches of Curl-X or whatever went in there, what layers of dressing, went on there. The important thing, of course, is the appearance of the wound, right? So the granulation tissue, the peri-wound skin condition, any drainage, any odor, any color of drainage, that kind of thing. And then, what else? Materials, time and date. If I did sterile technique, I want to document the fact that it was sterile technique. And I think that's about it.